Am I beautiful yet? Okay, so say hey when you're hopping on. I'm gonna turn portrait mode off so you guys can see really well. All right, hi, we're here. I'm here with Camille. I'm at Southern Surgical Arts, and I'm getting micro needling with Exosomes today. She said it's like so good for your skin. It's preventative, helping build collagen. So I'll let her talk about it more. But I've never seen anyone get this, so I thought it might be fun to go live with you guys. They offered a 20% off discount for anyone who uses like med spa services. So if you let them know like, hey, I saw Courtney's video or Courtney sent me, you can get 20% off. I was already here. I've been going to Carey now for a few months. She's who's been helping me get my like hormones tested and everything. She's here at Southern Surgical as well. They're also who's going to be doing my breast lift. Like, it's just a one-stop shop here. But if you mention again that I sent you, you'll get a discount. And today they're doing a giveaway. So if you share this video, like their page, and comment shared below, they're going to pick one winner for free microneedling. So which is like a really good value. So anyways, we're going to get started. All right. Let's do this. So we'll probably move it closer. If you have questions, y'all, like, have you ever gotten microneedling? If you have questions, then you can drop them below. I've been numbing now. All I have is like numbing cream on. I've been numbing now for a good minute.
Painless. We like painless.
Yeah.
All right. So I'm just taking it all off right now.
Perfect.
You're going to clean your face with alcohol.
Here, I'm going to take these out just because they're like dangly.
Okay.
Okay, if you want details and you're like, I need their info, if you drop the word me below, I can just send you who I've been using for my hormone, like helping with the hormones, and send you their info just so it saves you some time from having to like go search everything up.
Potent alcohol. Clean face is a happy face. No skin infections.
Perfect. It's so weird when you're numb.
I know.
I can't like feel like I can
Feels
smell.
like I'm ripping your face off.
Yeah. Yeah, it's pretty fun. Yeah. Well, like I can't feel.
At least you know it's working. All right, we'll get started here.
Do you think if we moved it down, they could see better, Sarah? What do you think? We'll try and get it.
Yeah.
We'll get it like lower for you guys so you can see a little more. Ooh, okay, so share, and then follow their page, and they're giving a free microneedling. So if you have friends that you think might like this, tag them in this video. Yeah, I think that's better. Do you? Doesn't? Oh, it doesn't like. Maybe. Okay, can you guys see? Okay. I wonder. Does it go any lower or no?
Yeah.
Let's try it just before she gets going. Okay, so what is it you use when you do microneedling? Do you have like a pen or a, how does it work?
So we use the Rejuva pen here. It goes up to 2 millimeters depth. However, you stay pretty superficial when doing microneedling because you're just trying to get right there in the superficial skin, just plump it back up.
So for people who've never seen microneedling before, is it a bunch of little needles, one big needle?
It is. I don't know if you can see inside. A bunch of little tiny needles in here. Itty bitty. If you've ever had Botox, they're about the size of a Botox injection. All right, my friend, and these are the exosomes, so these are going to help us glide across the skin.
Do you have to be local to win?
So, I mean, if they won and they aren't local, then they could, if they come to Chattanooga, they can get it done. But if they are local, then obviously it is easier if you're close by.
Sorry, loud buzzing here.
No, you're good.
And we just glide back and forth.
So, pain levels, it just feels like you have an electric toothbrush on my forehead. Like, I would not know that there's little needles. I am totally numb.
Good.
Like, it literally feels like, you know, if you, like, press a toothbrush too hard to, like, your teeth, like that buzzy feeling, that's all that feels
In your
like.
bones.
Yes.
You're doing great. So you might feel a little bit more in your hairline just because I didn't want to get all that gunk in your hair.
Okay.
But it's not bad.
No. Oh, well, here I've been so nervous for like the past hour while I've been numbing, and this is nothing.
You're doing great.
So the reason you do the exosomes is because it's going to help stimulate collagen.
Right. So it's cell-to-cell communication. So it's going to have growth factors, all sorts of things that are going to rebuild tissue. It's essentially waking up your own stem cells. Very, very potent. They're derived from adipose tissue, but it's very sterile. These are not made from umbilical cords. It's actually made in the lab, just from adipose.
Is the audio working okay? Can you guys hear? Saw a few comments that the audio was breaking up.
I can talk louder if I need to.
Do you want to come in closer so they can see? If you flip the screen around and you just kind of video Sarah, see if that makes a difference.
I have some plug-in mic to cover.
Oh yeah, that'd be
Radio.
awesome. Thank you.
Oh wait, so he brings that on.
Still feel okay?
Yeah, I feel great.
Okay.
I mean, it literally just feels like an electric toothbrush.
Yeah. Exactly. Really good.
Well, I feel like when you hear like the phrase microneedling and it's like a bunch of tiny needles, you're like, ah!
It's intimidating.
Yeah,
for
it's
sure.
intimidating. But so even for someone like me, I have had microneedling done one time before, probably 5 years ago, and just to help like stimulate collagen. And then I have like naturally a deeper wrinkle across my forehead that like my mom has it, like, you know, it's just kind of like a wrinkle. And so to me, like preventative skincare is really important. Like my grandma always preached, like probably from when I was 10 until she died, like take care of your skin. Like you only get like, you know your age because of your skin. Like always moisturize, always use your skincare, always do like whatever you could do to help your skin stay as like youthful, and like your chest, your hands, like all of it, you know. So even though if someone was like, well, you don't really have a ton of wrinkles, the reason you... Okay, perfect.
Thank you.
Do you want to pick this up, Sarah, and turn the, like it might show you for just a second. You can say hi. Everyone meet Sarah. She works with us. And so if you flip the camera around, you can kind of probably come in and they can see a little closer of what's going on if they want to.
Okay. How do I flip it? Show me.
Here. No, you're good. It's that camera with
I
the
see it. Okay.
swish or whatever, the circle.
Okay, there we go. Oh, this is better.
Yeah, you feel like they can see better?
Yes,
Sorry, guys.
very much. Someone said, is that a sub-Q needle?
It's yes. It's very, very superficial.
And I mean, it's not hurting at all. I have had laser treatments done before. I had one before my wedding, and I felt like my face was literally on fire. So this is fantastic.
How long will it stay red, and will you scab afterwards?
You won't scab. You shouldn't scab. Again, you're saying pretty superficial. And you'll be red for about a day or two. It just kind of depends on how your skin heals. However, exosomes have a lot of anti-inflammatory properties in it. So you're actually going to heal a lot quicker. She'll notice her redness is gone even by tonight.
Oh, wow.
It's really nice.
And when can she wear makeup again?
Honestly, 24 hours, but it's best to wait at least probably 48, 72, just to let your skin breathe and really get the most benefit. But if you can't wait, at least 24.
Oh, no, I
We've got sound off. Can you guys hear? What the heck is going on?
Still doing okay?
Yeah, I'm good.
Sometimes the eyes can be a little tender.
Yeah.
Doing really good.
So I love it here because you can get like like I'm here, technically I was here for my doctor's appointment today, like for my hormones. Like it's time for my blood work to be ran just to see how I'm doing on like hormone therapy. I have PCOS and I'm insulin resistant. And so I had been looking for a hormone doctor for a while, and or somebody that could kind of help like with wellness, weight loss, like help with like why is my body, like I'm dieting, I'm exercising, I'm doing the things, why did I hit a plateau? And it turns out it's because like my hormones were off. And so so I'm here for that. Like I see Carey, she's fantastic. Like seriously, if you ever are feeling like you need your hormones tested or you need like your lab work, she does full, like really thorough lab work. And she also can do it even if you're not in town. She can put a lab order in for like a lab and then go over all your labs virtually. Like she is seriously like so thorough. And so that's what I was here for today. But I love the fact that I can just like, I was literally numbing for this while I got my blood work for my hormones done. Like so awesome. And then after this, I'm heading straight downstairs to go over like some of the details for the breast lift surgery. So it's kind of like one-stop shop, like, which is so good if you're busy or like I have 4 kids. And I don't get to do things like this often, mostly because they just take time. And so it's really nice. And so anyways, I have never seen someone get this done with the exosomes before, and I think that like finding somebody who can help with your hormones and all those things is like hard. So I like love to share when I find something I love. So, and then if you've been wanting something, if you drop the word me below, I can send you all the details of like who I've been seeing here, what I'm getting done. And then I did ask them if I could get a discount for my followers just to see if they would say yes. And they were like, yeah, we could give them 20% off. And so that's really awesome for you guys. And if you share this video, they're giving away a free microneedling, which is like, how much is microneedling typically?
Just regular microneedling without any add-ons is $2.99 full face.
Okay.
And you can either add PRP or exosomes. And that's an additional $3.99.
Okay, perfect. So they're giving away a free microneedling. So a really nice value.
And what do they need to say? They need to share it and then
share the video and follow their page, which I tagged in the description, and then just comment shared below, and then we'll pick someone who shared as the winner. Like we'll probably pick in like 24 hours, so people who watch the replay have a chance to win as well. And then we'll pick a winner. And the way we pick a winner is I will comment in the description who won, and that you have to reach out to me on my verified page, like with over 400,000 followers, like because every now and then somebody will set up a fake account and it's so annoying, and they'll be like, you're the winner, go fill out these things, and it'll have like 4 followers, and that is not me. So the way you win is I will tag you, you will reach out to me on the page that has a bunch of followers, and that's how you'll know like, oh, that's her real page. Because sometimes people use my pictures and set up a fake page and it'll have like only a couple followers. So that's how you'll know if you're the real life winner. Just so there's clarity out there. Here, it's so crazy that people do that.
You're doing great.
Thanks, you're doing great. I'm just laying here. You're the one doing all the work. Okay, so what all services do? You do like, you're known for your lips, right? Camille has a big like Instagram following.
I do. I love lips. They're very fun. They really change your face. But we do lots of things. All types of dermal fillers, so jawline, cheeks. We do lips, temples, nasolabial folds, marionettes. We also do hyperdilute radius.
So what are those things?
Yeah, sure.
Layman terms. Because I'm like, what is a temple?
Yes, temple. So oftentimes a lot of people leave them out, and it really changes the face. A lot of people fill their cheeks trying to get a nice lift to the face. However, your temples are back here. If you stand in the mirror and pull them up, you'll notice how much it really lifts the lower part of your face.
Oh, wow.
And those are left out a lot, and people are really full in the cheeks, and then kind of hollow through here. You look a little bit alienous. So, feel those temples, you get a nice lift to the face. And you also get a lift to the brow as well, because you're pulling all that area up. Really nice treatment.
Oh, wow. And that's not what I'm getting done right now. That I'm getting microneedling, but she's just explaining like one of the services that they have is for that you can do that, fillers,
the hyperdilute radius. We kind of build deeper, so it's essentially close to what microneedling with the exosomes is doing. You're building that tissue that's lost, the collagen that's lost in the skin. Sorry, that one got you?
Yep. That's the first time it's like been a little hot.
Yeah, the eyes are a little tender. You're doing great. Doing great. Okay?
Yeah. And you guys do like laser hair removal.
Laser hair. We do tattoo removal. Skin resurfacing. We have microneedling radio frequency. So you're going to get a little bit more tightening with that. It builds a little bit more collagen with that extra added heat energy. Great. Got to treat the under eyes. Those are probably the most frustrating areas for people. It's the lines under the eyes.
So this microneedling treatment is gonna, with the exosomes, is just going to help my body like produce more collagen and just help with like my skin being more youthful in general.
You get that nice glow. It'll actually shrink your pores.
Oh, nice.
Tighten skin. Give you that nice pretty glow.
How often do you recommend like services like this?
I say to do this 3 to 4 times a year. If you're one that gets Botox, kind of keep it up with your Botox schedule. You can't do them together. So I recommend doing your Botox the week before, then coming in and doing your microneedling, because like you mentioned, you have the stubborn lines sometimes. So when you're treating the skin here and you're trying to build up that new tissue, you want to make sure you're not working against the muscle. You want that muscle to kind of be at bay, a little paralyzed, so you have more benefit of getting that skin nice and ironed out.
And if you guys follow me on Instagram, like Courtney Swan, I'll go like I shared like earlier getting numbed up. I'll share an after video, just showing like what it looks like. Hey Sarah, do you care to put that back on the tripod and then just take a couple like little videos for me, just so for that I'm gonna make a little reel for you guys and for the people on Instagram, because some people don't have like Facebook and Instagram, so try to like fill everybody in on both sides, like so in case you were, but we don't leave anybody hanging. I have like the worst habit to be like, oh no, I meant to film that, and then I got distracted like getting this done and I forgot. Thank you so much. I mean, that numbing cream you use is like legit.
It's great. So it's the 2 different kinds, the lidocaine and tetracaine. You're really getting a nice numb. Wears off in about 20 minutes, so you don't have that dentist paralyzed mouth.
That's quick.
It goes away quickly. So after care, you're going to make sure that you're treating it kind of like baby skin, just because it's going to be a little irritated. Gentle cleansers, no acids such as salicylic acid, benzoyl peroxide. You're not going to be using any of that for at least 4 to 5 days.
Okay.
No retinol and no exfoliating with the beads, like scrubs, for about a week.
Okay.
And sunscreen always. Got to protect the investment. Doing great.
what is it you guys do for scarring? The doctor was telling me, like, after I get my lift, I'll go and get, like, I guess a laser for the scar at some point, like if I wanted to do that just to help with scarring, or that there's something that you guys do for like stretch marks and just scars in general.
Absolutely.
And then she was even telling me she had somebody coming in the other day that she was like, if you ever take your nose ring out, like we have a laser, or if you have like a hole, like, you know, like my sister has a hole where she used to have like a piercing. She was like, oh, we can fix that like with this laser. Is that the same laser that, like,
sure,
for this
so
scar?
you can use several different things. For the redness, sometimes we'll start with what's called IPL or BBL.
Okay.
And that's going to take out just the redness, really.
Of your scars.
Correct. The bright discoloration of it, it'll bring that down. I know this one feels funny on the nose. Or you can do, same thing we're doing here, microneedling, but you're going to add that radio frequency. Because that's going to build a lot more tissue back. So essentially what you're trying to do is build new skin cells on top of the scarred up, kind of keloid, tight scars. So it's going to soften and then build up fresh, new, healthy tissue over it. It shrinks stretch marks. So when you ask again about holes, it will also shrink holes.
And if people are like me, like I was like, I have no idea. Like I genuinely just came here to get hormones done, right?
Yeah.
And then I started seeing like they've got like little cute banners and pop-ups and stuff, and I was like, well, maybe I need to get that done.
Right.
Like I didn't even know that was an option. So can they do a consult? How does your consults work?
They are complimentary, and you can do treatment same day if interested on most things. Like you had to numb for an hour. Sometimes that's not as doable, just because our schedule stays pretty consistent. However, sometimes we're able to work you in for same day treatment. Give you several different options on what your concerns are, so it's not just that this is best for you. You kind of get to learn and pick what you feel like would make you the happiest, would really give you what you desire after speaking. We also give pricing. We have lots of before and afters on our Instagram. Sorry, I got that nose ring there. Doing great. We're almost done.
So if you're interested in like scheduling a complimentary consultation or like a free consultation, drop the word me below and I'll send you all their information of like who I'm seeing and their phone number and everything, just to save you some work. And then or if you just like want to save it, you'll have it. And then they are doing the giveaway today for free microneedling if you shared and followed their page. And if you mention that, like, oh, I heard about it from my friend Courtney, you'll get a 20% off of whatever services you choose. So, which is awesome.
Right here on the chin. Good. So good.
Thanks.
There. Overall, besides the two spots, pretty tolerable.
Oh, this?
Yeah.
I mean, it literally feels like you've just taken an electric toothbrush to my face.
Yeah.
Like, it's
Good.
more than tolerable. Like,
Good.
I can tell now that we're getting closer to the end, like,
Feel it a
that
little bit
I can
more.
feel it a little, but nothing painful.
Good. Just pretty up spots.
Yeah, get all in there, all those pores.
Those pores.
Shrink those pores.
Good job, good job. And I'm coming to the top of the lip and you are done, okay?
Sweet.
This will really help prevent lip lines, even if you're not a smoker. Unfortunately, you use that muscle so much. You kind of eat away at the collagen. It's very frustrating.
Or like drinking through straws,
Drinking
like
through
Stanley's.
straws, exactly.
Okay, if you have any questions for Camille before we hop off, drop them, and I'll do like a little Q&A real quick before we end this live as well.
Somebody just tuning in, just asking the benefits. So if you want to just recapture really quickly some of the benefits.
Sure. So microneedling is going to help with the texture of your skin. It's going to help build collagen that's lost in the skin, shrink pores, give you that nice shine back to your skin as it dulls. It's also going to open up little microchannels for your skincare to get deeper, so it's not just sitting on the surface. You'll get much more benefit out of it.
It's more of a preventative type of thing. You stay red for a day or two, and then, but it's just giving, it's a needle, like a little pin that has like a bunch of tiny little needles, and like it kind of goes bzzz, like all over, and it's allowing the serum that she's putting on to go like deeper into my skin.
And a lot of people are saying ouch because they missed the fact that you said it does not hurt.
Oh, it doesn't hurt at all. Like, not at all. I would put it at like a 1.
Would you choose this over a chemical peel, and why?
It depends. It honestly depends. So if you have a lot of pigmentation, so sun damage, chemical peels are probably a little bit better, just because they're going to focus more on pigmentation. They will help with texture, give you that shine. This is really, microneedling will help more build up the firmness of your skin. So if you're feeling kind of crepey, you see those fine lines, wrinkles, probably microneedling is a better option for you.
And a couple comments about how beautiful your skin is.
Oh, her skin's
Oh,
fantastic.
thank you.
Yeah.
Microneedling.
There you go.
So if you do certain things like maintenance or preventative, or just like helping your skin to like make more of the collagen that it makes, or things like that, like as you do age, you just have like the benefits, you know. And if you have waited and now you're like starting to notice your skin, there are things that you guys can do to like help reverse some of the aging too.
For sure. It's never too late. Never too late. So we're going to put these exosomes on after as well. So we microneedle them in. We wiped her face off, got it nice and clean. You can see she's slightly red tinged, a little pink. Again, like I mentioned earlier, there's no scabbing. You can tell there's not a lot of the little speckled bruising. Very soft treatment, very superficial. So we're going to put these on after so they can kind of soak through those microchannels. She's going to leave this on till tomorrow morning. Let them percolate.
Got to get a good percolation.
Right. And again, she'll feel a little warm, kind of like a light sunburn. That just happens when the skin's a little traumatized. But that's what we were going for.
A few more questions about the cost too.
So just the microneedling alone is $2.99. The add-ons of PRP or exosomes is $3.99.
So do you get benefits just microneedling on its own?
You do, and we'll use just regular peptides because you have to have a gliding serum or else you'll kind of rip through the skin. It's not comfortable. So you just get more benefit using these added growth factors, whether it's your own from PRP or exosomes.
So I've done the PRP before. It's, so for those of you who have it, it's like platelet-rich plasma. They draw your blood and centrifuge it, and you're getting out like the, you could probably explain it better. I'm not really, you want to explain it?
Sure. So it separates into platelets. It kind of looks goldy. We call it liquid gold. So in layman's terms, if you ever scratch your leg, fall down, get a nice little boo-boo on your knee, and you notice that over time it starts to build a nice wound bed, same thing with the platelets. So we're coming up underneath, we're kind of traumatizing underneath the skin, makes it think that there's a wound. So then all those platelets react and build new tissue. Same idea of what would happen naturally when you traumatize yourself accidentally.
And so the exomes, if you're scared to get like your blood drawn, or like I do not want to do that, you can get the exomes like she's doing on me. Exomes are a little more powerful too than your own. But you can, on the platelet-rich plasma, you can actually inject that like into, say you have like problem areas under your eyes and in different things, you can actually inject like platelet-rich plasma. So there's like, but that's why a consultation is so good, because they're going to be able to like look at the problems you have or your budget or what you're looking to fix, and then they can tell you based on these things, like this is the recommendation for, you know, like what's best for you. Like it's all individualized.
Very true.
Okay, friends. Okay, be sure you share it if you haven't shared already. Like their page and comment shared, because they're going to be giving away a microneedling to one person. If you do want to book something, if you drop the word me below, it'll just send out an auto message that tells you like their information. Let them know Courtney sent you, and you'll get 20% off. And I will like I went to the chiropractor today. I'm like, my poor back. Okay, and I'll show you guys like a close up. Losing my little thing. That's just because my mascara. But here you go. Anyways, this is, it literally does not hurt. Like, so anyways, it's just, and you can kind of see it made all these tiny little holes, but those holes won't last forever, right?
They don't. They'll close in 24, which is why I say keep your skin nice and clean. This will really help your skincare over the next several months. Let it get a little deeper.
Yeah. So anyways, and then just wanted to let you guys follow along. So I hope you guys have a good day. Bye, y'all.